Welcome to this high-yield case study on preeclampsia, a critical topic for understanding maternal and fetal complications in pregnancy. Today we'll explore how abnormal placental development leads to fetal growth restriction, oligohydramnios, and maternal hypertension. Let's begin. Our patient is a 31-year-old woman at 28 weeks gestation with chronic hypertension. Her blood pressure is significantly elevated, and she has proteinuria. Ultrasound findings show oligohydramnios and a growth-restricted fetus. These findings strongly suggest preeclampsia. Preeclampsia is defined as new-onset hypertension and proteinuria after 20 weeks of pregnancy. Risk factors include chronic hypertension, diabetes, and systemic lupus erythematosus. It often presents with complications such as fetal growth restriction and oligohydramnios. In a healthy pregnancy, spiral arteries are remodeled to become low-resistance, high-capacitance vessels. In preeclampsia, abnormal cytotrophoblast activity prevents this remodeling, leaving the spiral arteries narrow and tortuous. This results in high placental vascular resistance, leading to decreased oxygen delivery, fetal growth restriction, and oligohydramnios. Preeclampsia presents with maternal hypertension, proteinuria, and sometimes edema. Severe cases may involve end organ damage, including thrombocytopenia and renal dysfunction. On the fetal side, growth restriction and oligohydramnios are common findings. Let's reinforce your understanding with a USMLE-style question. Compared to normal placental parameters, this patient most likely has which of the following hemodynamic changes? Consider how abnormal placental development affects vascular resistance and oxygen delivery. The correct answer is B, increased placental vascular resistance. Choice A, decreased resistance. Normal pregnancies show decreased resistance. Choice C, increased oxygen delivery. Oxygen delivery decreases in preeclampsia. Choice D, decreased erythropoietin. Fetal erythropoietin increases in response to hypoxia. Choice E, increased perfusion. Uteroplacental perfusion decreases due to high resistance. Abnormal development of the spiral arteries in preeclampsia results in high vascular resistance, reducing oxygen delivery, and uteroplacental perfusion. Management of preeclampsia includes blood pressure control and close monitoring for mild cases. Severe cases require magnesium sulfate for seizure prevention and often expedited delivery. Fetal well-being is assessed with regular ultrasounds and biophysical profiles. To summarize, preeclampsia results from abnormal spiral artery development, leading to high resistance and decreased uteroplacental perfusion. Key findings include maternal hypertension and fetal complications. Management focuses on blood pressure control and timely delivery. Thank you for joining this high-yield case study on preeclampsia. For more USMLE Step 1 obstetrics and gynecology topics, explore our playlist. Don't forget to like, subscribe, and continue advancing your knowledge with us.